Dr. Milin. So I welcome you all in new video series where we'll be indulging in with different medical graduates from all over the India. So today we have a very special guest we'll be having conversation with. We have Dr. Shubham with us, who is pursuing post graduation in radio diagnosis in Lady Harding Medical College. Hi Shubham,
Hello, sir. Thank you so much for having me.
please introduce yourself.
I am Dr. Shubham Arora from Lady Harding Medical College. I am PG2 in radio diagnosis. I'm also a medical illustrator.
So nice to meet you, Shubham. So tell us about yourself, from where you are and from where you did your undergraduation and all.
Yes, sir. I did my undergraduation from University College of Medical Sciences, New Delhi, and doing my residency from Lady Harding Medical College, New Delhi.
Yes, so
I'm
all like when we talk about Indian students, like when we complete our plus two, most of the students they're like, I
hmm,
want to become a doctor. So, what was your reason to
yes.
come into medical field?
So actually, my father is a pharmacist. So doctor related and drug related, medicine related talks had always been the part of the family. Uh, I was not so good in my studies initially. I used to be in co-curriculars a lot initially, but after eighth, when the bio was introduced, somehow I really gained the interest. I really liked it how we are able to read about ourselves. That idea really clicked me. Earlier I didn't. I used to study the amount I only required to pass the exams, and I was not much interested in that. I used to do art and some art, not a lot of art. Then I got into studies a bit. Then I got into competitive also. Like I always had a thing with the maths. We had in the school we used to do maths also. Like in
Mhm.
plus two, in 11 12 we it was compulsory to take maths, so I had maths also and science also. So I realized ki I am naturally good at it. I just
Okay.
didn't give it a try earlier. So it was a natural for me to take a bio, and in like I didn't doubt myself for even
Mhm.
once. Like I was good at maths and I scored 99 in mathematics also in my 12th board examination. And my father was like, you should give an IIT JEE examination at least, just for a try. But I didn't fill the form also. I just thought, I am very sure that I want to take this only in my future. Even if I cleared that exam, that would create more confusion. So I didn't. So I was very sure.
Do you have any other doctors in the family, or you're the first, the flag bearer?
Uh, no, my brother is. He's 1 year younger than me. Oh,
Mhm.
sorry, 1 year elder than me, and he started it, and then next year I got into.
So I can, like whenever we get admission, because recently the NEET UG result also came out, and there are a lot of students who dream about, pursuing career in medical field.
Mm.
So, what was your feeling when you joined the medical college? How were the initial days?
It's a really different feeling. Like everyone says, ki you are spoon fed, and school is a very different atmosphere. Then you got into college. It's really different. Like you try to earn your place in the crowd, and you try to make yourself recognized. Like it's different for everyone. But that was my idea. I don't want to be the one in 150 and no one recognizes me. It had always not been never been my idea. I want to do something, and people see ki, yes, this guy knows that part of it, if not everything. I don't want to be the jack of all.
True.
But yes, initially it was difficult, but I got some really good friends, and they always had my back, and I think I did for them. So it was really good. Initially it was difficult, but then like everyone says ki there is a bond with the college, the parent college, with the friends, with the people there. And I think I had really good time in UCMS.
So, like whenever we pursue our MBBS, MBBS is a, when you compare your, post graduation and undergraduation, they are completely different fields. So, do you remember
Yes,
any
sir.
best moments from your MBBS days that you want to share with us?
Uh, I think I always remember like our fest, the annual fest is called Ripple. So I had performed 3 years. I used to perform there on stage, and I think that moment is like so surreal, and I can never forget. It was like I had given perform. I used to give stage performances live art. Like I used to do that in not impromptu, but like I used to prepare those artworks. But I used to change a little bit when on stage. So in 5 minutes, I used to draw something. Initially, it was more like celebrity art. Then I started with something like making based upon a poetry or poem. So that was my thing, and so I performed that, and like your own crowd, your own people, your own seniors, juniors, and everyone started clapping. So I think that is something I really cherish. I still see those photos in my gallery, and I really remember, and it's a really good feeling,
Yeah,
even remembering those
that's
moments.
that's a very good accomplishment, and I think the festival like this and the moments like this actually give you a lot of confidence. And I remember like even during our UG days and when I was doing post graduation, when I used to look at these MBB students, so a lot of students who were shy were not very comfortable opening up, and such festivals and such things will give them that chance, that opportunity to open up and boost that confidence. I
Definitely,
think MBBS not only builds the medical skills, but also I think builds a character in a way. So that period is definitely important. Uh,
definitely, sir. Like if I mention you, I used to do illustrations since long time, but it was very initially when I started with color pencils and I draw the Netters diagram. Like there was this diagram from Netters, and it was just a casual, and it was like 100 rupees pencil set that I bought, and I was like, yeah, just try want to try color pencil. I used to draw from the graphite pencil, but never a color pencil. So I just draw and I posted on Facebook. It was Facebook was very prominent at time. So I posted there, and everyone started key next netters, next netters. It was not my idea that I wanted to build something out of it, but like everyone said it, now it gave me an such a immense a sense of accomplishment. Ki I really did something, and I think I can do something about it in future. And that idea grew and grew, and now I have like this full fledged plan. I really want to make a necklace out of it. Like some, I grew as an artist also, I think, but I really want to make a necklace now.
yeah,
So I think
I have
that
I have seen your illustrations on Instagram as well, and that's amazing. I'm sure you'll do that.
thank you so much, sir.
Did you like we know you are an excellent illustrator. Apart from that, did you any other hobbies that thrive during MBBS days?
Yes, sir, not that much, but yes, I really like badminton and cricket also. I couldn't play it that much because of all the things I try to do, but yes, I really like playing badminton and cricket.
I also have one question, because as we are talking about hobbies, like one thing that we are seeing among MBBS students nowadays, they feel a lot of isolation. They feel lot of sadness and depression is out there, because there are sometimes it's very stressful, because sometimes we have a lot of expectations from us. The surroundings are not
Mhm.
very favorable. So did you feel any stress during your UG days, and if yes, how did you cope with that?
Definitely, sir. My the best coping mechanism that I used to follow is actually art only. There had been many days which I felt low, and my part of this problem was actually anxiety and these panics that I used to have. I had always been that kind of individual who had always felt ki, what next, or what if this goes wrong, what if this goes wrong, the overthinking part of it. So that had always been a problem for me. But the illustrations have really helped me for that. But this was the exam time that was actually like a most problematic part, and it was really difficult for me to pass through it. I had always been the student who studies whole year, but during exam, because I was maybe because I was not able, I couldn't illustrate at those times, or maybe the time is so difficult and the environment is so panic, you are not able to connect to your friends also. But at during those times it was really difficult for me to cope up. And yes, I won't say ki it was ki I had always been in a stable position, but I think the friends really help. These things really help. Any co-curricular activity you are doing, maybe reading or maybe going out for a walk, and these help. But yes, you have to make yourself stronger, and I think that comes within years. And it is not that ki I didn't face these things in my final year. I did. Like it was nearly same as the similar intensity I faced in my first year. So I think the residency part is what it differentiates. In during whole of my UG days, I faced the similar problem that I might not be good enough for the exam or not. All the overthinking part that sustains and persists. I think many medicos will relate to it.
Yeah, and that's the beauty of MBBS curriculum. The students who get 99% in 12th, suddenly they start feeling They feel they are
I
not good
see.
enough, and we barely run behind passing marks. That's the beauty of it.
Mhm.
And I understand, and that's very nicely put forward by you, that whenever you have this negative energy, or you feel that low, you need to channel that energy into something else. Like, you found illustration as escape from your stress. And that is why we are talking about importance of having hobbies or learning something. I remember during my MBS days also, I made a list that I should be able to play one sport nicely, like not just play. I should be able to at least learn one musical instrument. I should have one
Mhm.
proper like hobby. And I made a list, and I think that is also something that helped me also to cope up with a lot of anxiety, because we all go through the same. It's not like we are built something, or some people are different. But I think somehow if we learn how to come over that isolation, it will be easy. I'm not saying that it will be easy for everyone, but it will definitely help in.
Definitely, definitely, sir.
So as we look at you as a radiologist today, so when this love for
Mhm.
radiology started, like how did you come to the conclusion, okay, I want to pursue radiology as a post graduation?
Actually, the story is not that. Uh, I had always been a huge fan of surgery. Actually, people, I don't know ki, what was the reason behind it. Ki some people said ki you're good at art, so you should try for the surgery in initial days only. And I think that's a good idea. Maybe my hands are, my fine hands might help in the surgery,
So,
and I might be a good surgeon. So in second year itself, actually in first end of the first year, and I was like, "Ki, I want to do surgery, and I will start going to the OTs also." So I talked to one of my consultant, and he was very nice, and he asked me, "Yes, you can come to my OT, and I will show you the." I think, as far as I remember, it was cholecystectomy surgery, and he got me in to the surgery, and I saw the surgery, and I was really fascinated. I was like, "This is the thing I really want to do in the future," and. I used to attend the seminars. I used to go to the minor OTs for ENT in ENT also, because I wanted to make the fine sutures that are usually lacking in the surgery department. So I wanted to find sutures. So they taught me the subcuticle sutures, the vertical mattress, horizontal mattress, and everything. Like, I really liked doing them, and I started doing them in my second year also, third year also, and I was so fascinated with all the surgical parts. I remember it was, I think it was starting of second year. I think fifth sem or fourth sem, and while coming to the main department, it was 1st January. I remember it, 1st January, and there was a board in the surgery. In the We have a conference hall. We don't have a Audi there, but there's a conference hall, and there was a big board that there is a conference on trauma surgery, something related to that. And I just entered there. I didn't go to the classroom. I just entered there, and I was like so fascinated. Ki I might sit there, and there was a faculty, and there was a foreign faculty, one Indian and two foreign faculty, and the three of them were not from India. And they didn't check my ID or something, so I just got in and I sat there, and some of the PGs knew me, so they were like, "Ki, why? What are you doing here?" So I just said, "Ki, I just wanted to see one or two lectures and something." But they had some hands-on experience also. They let me do some cadaveric chest tube insertion and sutures there, and I was felt so nice. And one of the consultant recognized me, and he introduced me. Ki he's a fourth sem student, and I also felt so happy. Ki he will take surgery in future, and he's very excited and very promising and all. And I felt so nice, and I till final year I was like, "Yeah, I will take surgery." I was praised in my final year viva also, and by the externals and even the internals. So I thought, ki, I think this is my thing. But I think the internship changed everything for me. I think it was not meant for me. The academic part was good. The every theoretical part was all good, but the patient part was something I didn't expect. I was good with the patient, but I think I was too attached to them. That I realized later in the internship, in the ortho posting, and later in the surgical posting, that I think this is not for me. I really took a decision that was the hard decision. I still feel little sad about it, but I think radiology is something for me. So I feel overall happy ki I took radiology as my decision. In internship itself is not like many people say ki after rank did people change, but it was in my in internship only I decided ki no. I think I really need a branch in which I can sit. I really like reading. I really like making diagnosis, and I really like making the solving those puzzles, though it's usually not there in the actual life, but sometimes we do get a chance. So I think I really feel happy about it. I took radiology and not surgery. But
yes,
yes, surgery is a branch for you if you feel that excitement for surgery.
yes, I know that is very nicely put, and this is what something I want to tell you, the people who are watching, this session, because the perspective perspective of intern is completely different. Like as an MBBS student, everybody likes medicine, everybody likes surgery, and suddenly
Yes, sir.
when it comes to the responsibilities and real world, it's completely different. And that is actually the base of my next question. That now you're doing residency, you're a second year resident in Department of Radio Diagnosis. So what is the difference do you feel? During preparation, you're like, yaar, mujhe PG karni hai. I want to get a seat, and I know you have all that excitement. You all have that dream, and now you have crossed that line, and you're pursuing your branch. So how do you feel? Have you made your expectations, like the expectations were during the preparation time? Do you feel any different, or
Mhm.
do you feel like okay, it's okay only, not like what I thought?
Sir, I think there is a sense of responsibility. Even I can say this for the first year and second year also. Like the first year, there is always a senior with you, and there is usually a senior who is making a diagnosis, and you're writing the report. And suddenly in second year, you have that probe. I had said similar things in the to my co-PGs also. Like when you get that probe, now it gives a sense of responsibility. Ki now the probe is on you, with you, and though the SRs are behind you sometimes, and sometimes not, but they were not always behind, and they are not seeing the screen always also. So there is a sense of responsibility. Like you are seeing this patient, and if anything misses, then it's on you. In government hospital, obviously there is a time crunch, but what I realize is this sense of responsibility comes in, kicks in, and ki whatever you are doing is actually might make a significant changes in that part of that patient's life, that might be thankful or might not be thankful, but that is not a concern. But the point is that you are actually making a difference in that person's life. So
That's true.
that kind of change, when you I think that is the same for that point also, ki when you read books, you theory books, that the life is very different, but suddenly when you are actually treating the real patient, the life is very different. And no patient is directly from the exam case, so everything there is element of change that can happen. So I think there's a lot of difference that had happened, and still adapting to it.
Yes, that's and you'll get used to it with time. You have done, as a
Nice.
radiologist, definitely you'll accomplish a lot of things. And one of the thing that one of your major accomplishment in the recent times, that you have co-authored a book with Dr. Sumer Sethi sir about in
Yes,
radiology.
sir, definitely.
So tell us about that. Like how was your experience?
So I would really like to share how we met also. Like we had always seen on screen and on the lectures, and we had always felt that person has that aura. And when I got excited about radiology, so he was the first person to look upon. I think that is same for most of the medicos. So I had always had a wish to meet him. We had met, but very unofficially, also in very in a professional manner. In when we had that a career counseling type
Mhm.
session he had with him. But then we have a psychiatry faculty there, and I was in contact with him, and I told him ki how I made illustrations and all, and he said ki Sumesan might be interested in talking to you, and he talked to him in further, and then everything happened in a way, and I was like, "Ki, this is so good," and it was like just out of those books that happened. And I got a call from her secretary, and that he want to arrange a meet, and then I met him, and Lucky, I had seen him as a teacher, but to witness him just there and talking things about it, and then he's so creative with things. So it tells you ki how experienced that person is in his field and how much he knows about it. And it was really nice to be part of that closed room discussion. And we finally decided to make a book. And initially, obviously, my core plan is to make an atlas, but he said ki let's start slow and
Yes.
maybe make something initially for radiology residents. And uh, I think it was a very belief. I don't know how he showed that belief in me, and in just one or two meetings, that he thought ki I could make a book on for resident radiology residents, and I was starting my journey as a radiology resident back then. So I think that was really insightful for him, insightful of
Um,
him, that
we
he
will
really. And uh,
we will
yes, I
definitely
feel humbled.
share a few of your images with the viewers, and I would also recommend to visit your page as well, because I have seen your illustrations, and they are absolutely amazing. And no wonder Sumesh
Thank
sir
you so
was
much.
interested, and he was amazed by your art. And definitely this is the first step, and I won't be surprised if I see Indian nature version of by Dr. Shubham, and this is definitely going to help our students.
Definitely, sir. My idea is ki radiology anatomy might help me to visualize things matlab orthogonal planes. Like to differentiate, is Dr. Nettas had done anatomy layer by layer, like how cadaver opens up from the skin to
Mhm.
subcutaneous tissue to fascia to muscle.
Mhm.
But now everyone, each and everyone, you are a
Mhm.
pediatrician, and they are surgeons, they are ENT doctors, and everyone want to know anatomical knowledge. And now everything is happening in orthogonal sections. No one is seeing anatomy in cadaver as
True,
we see. So there is a little disparity between what we learn and what we actually apply in the
true,
future. So
true.
I think I really want to bridge that gap. Still, the books are not covering that anatomy that well, and I think I really wish to contribute there and maybe remembered for that.
That's actually a very nice thought, and I really wish you best and for that. And do come up with that,
So,
so we can, we are also refreshed with our anatomy knowledge in that way.
yes, sir.
Okay, my last question to you, as you are a radiologist, so you'll be making a lot of money. So what you are going to do with that? What are your
I
ambitions?
think. Yes, sir. But my idea to for being a radiologist is had never been about money. Like still, people ask me, but I think that we have reached that part of life, and just 1 year is left for the residency to get over. And everyone's discussing what they wish to do in future. There are some options with the radiologists that they can go to a private center, which will give you a good amount of money. But I think I will lose as a
Not good,
accommodation
but
there. I would.
just a lot. A good is
Yes,
not
sir.
about it.
I know, sir, but
But what are
I
you going to
think
do with that? That's
that
what
is
I'm
not the
asking.
part of. Yes, I didn't get you.
What you are going to do with that? Like, are you going to buy a fancy car, or like, or you haven't thought about
Maybe a good, maybe renovate my street table. I think that is the
it?
focus thing I do. I had always seen those big fancy glass and mirror imaged those study tables and did the artist point,
Yeah,
and I really want to do that maybe, and maybe
definitely.
buy me a new tablet also. Those things are also expensive.
You are, that's a very humble of you, and I think, I'm sure you'll do great in life. And
Thank you.
thank you so much for joining us today and sharing all your experiences with us. And
Thank you so
we
much,
will
sir, for
meet
having me.
again.
It was an emotional ride.
And same here. And I wish you all the best. And take care.